We will now begin our assessment of the heart and neck vessels. To begin, observe, auscultate, and palpate the carotid pulse. Auscultate for the presence of a thrill or any abnormal sounds. Next, estimate the patient's jugular vein pressure. Observe as they sit in a sitting position for any jugular vein distension, and then have the patient move to a 30 to 45 degree angle. Using the angle of Louis and the highest point of pulsation seen on the jugular vein, estimate the pressure. Holding a ruler at the angle of Louis, the sternal notch, locate the highest level of pulsations and measure. No jugular vein distension is currently noted. Next, assess the precordium. Locate the apical pulse on the patient and palpate. Note any heave or thrill, and note for any pulsations that can be palpated. Once the apical impulse is located, palpate for any heaves or thrills. Note any pulsations. Next, auscultate the aortic, pulmonic, tricuspid, mitral valves, and Erb's point. Note the rate and rhythm of the heartbeat. Listen for S1 and S2, and note any extra heart sounds. Also note for any abnormal heart sounds that you may hear, and listen for any murmurs during systole and diastole. The aortic, at the second intercostal space. The pulmonic, Erb's point at the third, the tricuspid valve, and the mitral valve should be present at the fourth or fifth intercostal space at the midclavicular line. Note the patient's rhythm, if it's irregular or regular, and note the rate. His heart rate is currently at 80 beats per minute, has a regular rhythm, S1 and S2 can be heard, and there were no extra heart sounds noted. Next, perform the same assessment listening with the bell of the stethoscope. The aortic, pulmonic, Erb's point, tricuspid, and mitral valve. As the patient sits in the sitting position, listen to the bass of the heart. Next, have the patient lie in the left lateral position and listen to the apex of the heart. Note any extra heart sounds or any murmurs that can be heard during systole or diastole. This concludes the assessment of the heart and neck vessels.